How can I prevent bacterial infections after my child's flu? When your child catches the flu, it can be tough to see them unwell. But did you know that the flu can weaken their immune system and damage their respiratory tract? This makes them more vulnerable to bacterial infections like pneumonia or ear infections. Fortunately, there are proven ways to help prevent these complications. First, making sure your child gets the annual flu vaccine is key. The flu shot reduces the chances of catching the virus and lowers the risk of serious complications. Additionally, vaccines against bacteria such as pneumococcus and Haemophilus influenzae type B are recommended. These vaccines help prevent bacterial pneumonia and other infections that can follow the flu. If your child starts showing flu symptoms, seeking medical advice early is important. Doctors can prescribe antiviral medications that work best when taken within the first 2 days of symptoms. Early treatment can lessen the severity of the flu and decrease the chance of bacteria taking hold. Good hygiene practices are also essential. Teach your child to wash their hands thoroughly with soap and water for at least 20 seconds, especially after coughing, sneezing, or blowing their nose. Encourage them not to share drinks, utensils, or towels, as these can spread germs. Covering coughs and sneezes with a tissue or their elbow helps prevent droplets from infecting others. Keeping your home clean is another important step. Regularly disinfect high-touch surfaces like doorknobs, toys, and electronic devices to reduce the presence of viruses and bacteria. Supporting your child's immune health by ensuring they get enough rest. Eat a balanced diet rich in fruits, vegetables, and lean proteins, and stay well hydrated can also help their body fight off infections. Avoid exposing your child to tobacco smoke, as it can impair their respiratory defenses and increase infection risk. Monitoring your child for signs of bacterial infection is crucial. If they develop a high fever that persists, difficulty breathing, ear pain, or become unusually tired, seek medical attention promptly. These could be signs of bacterial complications needing treatment. When a bacterial infection is diagnosed or strongly suspected, antibiotics may be necessary. However, it is vital to use antibiotics only under medical guidance to prevent resistance. Never give antibiotics without a healthcare provider's advice. By combining vaccination, early medical care, good hygiene, a clean environment, and supportive health habits, you can greatly reduce your child's risk of bacterial infections after the flu. Remember, always consult your healthcare provider for personalized advice and if your child's symptoms worsen or do not improve. Taking these steps helps protect your child's health and supports their recovery.